Dr Kyle Hoath is the WA President of the Australian Medical Association, and he joins me now. Good afternoon.
G'day, Ollie. How are you?
I'm very well, Kyle. What's your initial assessment of this $140 million winter surge plan, and do you think it'll make a difference?
Look, I mean, we obviously had a bit of a tough winter last winter, and with all the other unions, we came up with a bit of a plan, and this goes some way to addressing some of those concerns. I'd be more worried if there wasn't a winter plan, Ollie, and I think having some plan and having some resources at least gives us the opportunity to see a slightly better winter. Still a lot of detail, obviously, and the execution of that plan, the really important stuff. But no, it's good to see. It's good to see that they've taken us seriously and that they have implemented something ahead of winter rather than always being reactionary.
Have we got the right mix? Have we got enough health sector staff to actually implement this plan?
Yeah, look, that's going to be a tough one to figure out, honestly. I think there are the staff there, whether or not they are, capable or able to work, given some of the conditions and the burnout and the stress they face in their roles, is probably the trickier bit. We do rely still heavily on our overseas trained doctors, particularly from Ireland, to sort of inflate our numbers a bit, and pretty grateful for that because I would be struggling a bit without it.
Well, let's run through some of the priorities in the winter plan. There's $61 million to increase bed capacity, and basically those funds are going to allow the Health Minister to contract and to use private hospital beds during extreme demand. Is that going to work, Dr Hoath? Is that a good idea?
Look, yeah, so it's that, and it's the use of private facilities for elective surgery to create space in the public hospitals as well. So, look, it's an idea, and it's one that we definitely support. But with that kind of asterisk around, we have seen elective surgery wait lists get to extreme numbers before, where people die on wait lists, and we don't want to get into that situation again. So elective surgery isn't something we can just palm off to the tomorrow. It needs to be fairly considered and fairly well governed around how much can be pushed. But it is a strategy that we asked for last year, and it's one that we will continue to support because there are seasonal demand, and we do need to make sure that we're dealing with the most critically ill people during winter.
More than $24 million going towards expanding the Time to Think program. That's where older patients who are ready for discharge, they're moved to special beds in aged care facilities while they think about the next steps in their care journey. How well has that program worked since its introduction last year? I imagine you might be happy to see this expanded further.
Yeah, look, I am, and I think it was one of the good things out of last winter. One of the things that did have a bit of an impact. I think, unfortunately, it just couldn't match the demand or the growth in that part of our population. And again, we kind of know it was coming. You can look at the numbers and see that it's going to be an issue, but it still hit pretty hard. And so, despite having those time to think beds, we had pretty severe wait times and wait numbers for older Australians looking to get home or into a nursing home last year. So hopefully expanding that a little bit has more of an impact. But look, we know that that's one of the big bottlenecks of getting people out of hospital and therefore prevents more or people who are coming into hospital actually getting in the front door.
Kyle Hoath, my guest, WA President of the AMA, as the state government today outlining its winter health plan. 1300 222 1025 if you would like to join the conversation, because this next one is interesting, Kyle. $20 million for a new service. They're going to offer a 24/7 monitoring for older West Australians who want to return home to recover from illness. Is that achievable? Because I imagine it relies on home nursing services.
Yeah, look, I think a combination of that and the virtual ED and shock services are already do a lot of the coordinating and online monitoring of services across WA. So, look, I like the idea in principle, and I think that there are definitely people that should be at home getting appropriate care rather than being in hospital. If we can pull it off, that's great. It's going to be a tougher one, I would say. But again, I kind of commend that this is one of the things that we did ask for, and so I'm glad to see it included in the plan.
There's also $14 million to provide free RSV vaccines to West Aussies in aged care homes and to provide flu mist to kids. How important are those measures in preventing the EDs being overwhelmed?
Look, I'm going to sound like a bit of a broken record here, but it's a good start. For me, I think vaccines in general, particularly during the ones that are seasonal, they should be free, and they should be perpetually free, because it has a significant impact on not just on people presenting to hospital, but people's long-term well-being as well. And we know there's a bit of a vaccine hesitancy that's been around post-COVID. and anything we can do to kind of tackle that misconception and help keep people safe and keep people's neighbours safe is worth the investment. So, look, my biggest concern is really probably how they try and sell that. It's great to have the flu vax, the flu mist, and the RSV free, but for me, last year's don't assume you're immune felt a little bit flat, so I'm really keen to see what the marketing wizards come up with this time, because I think selling that message is really important.
The Health Minister, Meredith Hammond, also gave an update on the purchase of Mount Lawley Hospital today by the state governments.
We are getting close to finalising the purchase of this hospital. It will be known in future as Mount Lawley Hospital. It will become a public hospital on the 31st of August of this year. Importantly, between now and then, additional beds will be made available for public patients to help us navigate this winter. So this will provide support to our public health system through winter, but obviously as this hospital moves into public hands, it'll provide an additional nearly 200 beds to our public system. It also provides additional operating theatres.
So how important will the acquisition of Mount Lawley be, Kyle? But it doesn't come into state hands until August, so beds will be made available over winter.
Yeah, look, and obviously I think I was one of the optimistic ones that hoped this could be pulled off before winter. But even with some additional availability over winter would be good. I think last year, and this could be incorrect, but I think we used about 100 of the beds at Mount Lawley during our peak time. So it's not unusual for us to use beds at that hospital. So being able to access more of those to get closer to that full 200 will have an impact, because generally last year I would have said peak of winter another 300-400 beds would have really made a difference. So 200 gets us kind of half the way there. So it definitely have an impact.
Good on you. Kyle Hoath there, WA President of the AM.